Hi, this is Allie and Kaylee, and we are going to tell you about Delta 9 tetrahydrocannabinol today.
So, what is it? It's primarily psychoactive and found in cannabis, and it's also known as THC. So, we'll probably be referring to it as THC throughout this presentation. So, what THC does is it binds to cannabinoid receptors in the hippocampus for memory, the frontal cortex for thinking, and the cerebellum for movement, and it causes reactions that go through the entire body. So, THC eventually takes place of chemicals that your body usually makes itself, usually anandamide, which basically filters your memory just so that you memorize things that are important. So THC, or Delta 9 THC in this case, can be taken orally, local or topical, transdermal, sublingual, and inhaled.
So, who would use Delta 9 THC? People that have psychological disorders such as anxiety or post traumatic stress disorder, cancer patients because it gets rid of tumor cells and it helps with nausea and vomiting and increases appetite. People who have MS, inflammation, ADHD, Alzheimer's, arthritis, autism, and a whole bunch of other things, also chronic pain and fibromyalgia, migraines, strokes, Parkinson's patients. So a lot of people can end up using this.
So what are the effects? Mainly, it's increased appetite, decreased nausea and vomiting, and pain relief, but it can also be used as a muscle relaxant. It has sedative effects, tumor killing, like Allie just said, decreased inflammation, and cognitive and behavioral changes.
So the side effects, adverse reactions, and warnings. In general, this is going to produce stress relief, relaxation, improved mood, general pain relief, and social bonding. And it works short term and also has long term effects. Again, the short term, the relaxation, euphoria, sense of energy, pain relief. It also helps with anxiety and tremors. In the long term, it changes your memory. Once you have a decreased verbal memory, you can end up with bronchitis-like symptoms from the inhalation. You can build a tolerance to it. You can become emotionally numb. And also, there are no reports of lung cancer, death, or brain damage from using Delta 9 THC.
Okay, so just kind of adding on to that for ADRs and warnings, things have been reported such as anorexia, cough, fatigue, headache, convulsion, abdominal pain, ataxia, anxiety, hypotension, just a lot of things. I guess some of the more important ones: hypersensitivity, nightmares, tachycardia, depersonalization.
So some drug alternatives for this, mainly more so like different drugs that people are using that have the same effects as different aspects of Delta 9 THC. So chemotherapy is a tumor killing drug, and you can also use it's metoclopramide, which is usually prescribed for GERD, but you can also use it for nausea due to surgery or cancer chemotherapy. Steroids can increase appetite, and muscle relaxants for fibromyalgia, and then also NSAIDs for inflammation. So each of these things do different components of what Delta 9 THC do.
Okay, so we looked at two studies. So for the first one, we analyzed the cannabinoid medication dronabinol to see if the psychoactive effects are comparable to when smoking marijuana. So this was a randomized controlled trial. They were either giving a placebo, 10 or 20 milligrams of the drug. There are 30 people in the trial, and all of them were chronic, non-cancer pain patients taking opioids but not using marijuana. So they were monitored hourly for 8 hours for 3 sessions. And what they found out is that it had very similar psychoactive effects as smoking marijuana. So just a take-home message, the psychoactive effects are a risk that must be considered when either deciding to administer the drug, continue the drug, and especially when scheduling physical therapy.
So the second study looked at smoking cannabis 3 times a day for 5 days and then taking a 9-day cleanse. And the cycle was repeated 4 times. And they found that this helped with reducing the intensity of pain, and it improved sleep, and overall was well tolerated.
So we would recommend this to patients looking for an alternative form of medicine. If they are not receiving the results from conventional medicine that they wished they were, that they understood the effects of this treatment and had no contraindications to it.
And these are our references.
Thank you.